Good afternoon, everybody.
Hello.
Hello.
We'll go ahead and get started here in just a few more minutes while we have more folks joining. All right, welcome everyone. I'm going to get started in just a minute. I think we've waited for a few minutes past our start time, so we'll go ahead and get started and welcome everyone to our quarterly PEI collaborative meeting. As you may realize, I'm not Diana, so I'm filling in for Diana today along with my colleagues here as well to provide you with our quarterly meeting. My name is Mindy McFarland. I'm a staff development officer here with PEI. So we'll go ahead and get started as we usually do with some introductions just to know who's in the room with us, our Zoom room, and just a quick little fun poll. So let me go ahead and launch that for us. And we can kind of see who is here with us today. Now, our standard questions, just which region do you represent? Who is it that you serve? What best describes your work setting? And then if you can answer in the chat, what is your favorite sport or physical activity? So you can go ahead and put that for fun in the chat for our poll today. Give some time for those responses.
Mindy, this is Dakota. I can only get two letters typed into the sport. Is anybody else having that problem?
Oh, if you could put it in the chat, because I know it's not going to
Oh, that's
allow
it.
much of a response, but yeah, thank you
Thank
for
you.
sharing about that, Dakota, because I think that perhaps others are also experiencing the same struggle. Let's see. And thank you all for those responses coming in. We have golf and oh, baseball. I know a few of those. Sleep, that's mine too. Don't get enough of it. I miss it all the time. Walking your dogs, swimming, a lot of swimmers. I know Andrea loves football, baseball, and now soccer, Zumba, football, hiking. Lots of active people here. That's awesome. Let's see, we have a lot of folks who've answered in the poll. And so I'm going to go ahead and end our poll so we can see who we have with us. So it looks like we have a lot of folks from all over Riverside County and some joining outside of Riverside County. So welcome. And nice to see also we have a lot of pretty looks like equal representation across those that we serve. Great to see. And then our work settings, a lot of department folks here, other county departments, welcome our school groups. Faith-based organizations welcome as well. And we have our community-based organizations and some other. Anybody want to share in the chat like who the other represented folks are here? I think that's always interesting. If not, that's okay too. It's always nice to see when we can reach more folks and get those other categories filled in and have at the table here with our discussions. So thank you all for participating. Oh, others, contract employee. Oh, I see. Thank you, Dakota. Yeah, out in the field was our community, our cultural community liaison. So thank you for representing. All right. So I'm going to go ahead and stop that poll. And we're going to move in now to talk about our agenda and what we're going to cover today. So as always, we have our trauma-informed systems moment that Andrea will present for us in a minute. And then Andrea and I will be presenting to you all today on the behavioral health transformation, or BHSA, and what those updates look like here in Riverside County. We'll also have Triple P as our program spotlight. And we also have a program participant who has come to share with us about their experience in that. So very exciting to share that with you all. And then Annie will be providing us with our Suicide Prevention Coalition Fall Activities report out. And then we'll have time at the end for any PEI provider updates and, of course, our community roundtable and any announcements that anyone may have that we can share out with each other. So with that, I'm going to go ahead and stop this screen share so I can give Andrea the floor for our TIS moment.
Great, thank you. So any of my providers that are in the room at this point this month, you have already seen this video, so please act surprised like you've never seen it before. But for the month of October, we talk about understanding trauma and stress. And so I have a very short video. It is literally 1 minute and 5 seconds long, so we have to listen quickly. That talks about how stress can be created for us at work, but maybe not in the context that we're thinking of. So I kind of encourage you to listen from that perspective and consider how what's talked about in the video may actually contribute to your stress at work.
Research has identified numerous environmental factors that can cause workplace stress. As we review them, see if you can identify any times, past or present, when these factors may have applied to you. As you do, also reflect on what, if anything, was done to resolve them. Firstly, poor environmental working conditions. These may include dim lighting, inadequate ventilation, or uncomfortable desk stations in office-based environments. In more industrial settings, this may involve overexposure to contaminants or excessive noise levels. Overworking, as in excessively long hours, can also cause stress, as can a lack of boundaries on when a workday should start and finish. Poorly communicated objectives can make colleagues feel unsure what's expected of them and leave room for a mismatch of expectations. And a sense of not belonging or feeling part of organisational objectives can lead to a demotivated workforce and a sense of being undervalued.
All right, really quick, like I said. So one of the things that really stuck out for me in this video has caused quite a bit of conversation this month, even though it's so short, is the lighting thing. That's always a hot topic of debate on the floor here because many of my colleagues like dim lighting, where I'm like, no, I can't see. I need lighting bright. So like you come in my office and it's just like there's light everywhere, but out in the floor, I'm like, what? I can't, what's happening? So lighting has been a big topic of conversation this month. So anything that resonated with anyone else about things that maybe are creating or have created work place stress for you before, maybe not currently, but before, feel free to share. I agree, Dakota. I hate being cold. Y'all are quiet today because Diana's not here. Dakota also shared not having a clear vision or of the organization's mission or goals, right? If we don't understand what we're working towards, it can be hard to find the motivation to do that work. I agree with that. Yeah, Claudia, not having kind of that sense of privacy or ability to have some quiet to be able to do our work, especially if we're in a job where we have to do a lot of phone conversations or even Zoom meetings like this, for sure. Dakota. Our neighbors are gossipy. I promise I'm a good neighbor at the office, y'all. Unless you like bright light, then don't come in my door. All right. Well, maybe y'all are just real anxious to hear what's next on our agenda about BHSA. So we can, I guess, stop our TIS moment, but I encourage you to think about how your environment at your workplace contributes to stress or not, because there are some things in our environment that we have control over. And so if we can work to reduce our stress on the things that are within our control, it can make us happier and healthier at work.
Awesome. Thank you, Andrea. And so I am going to see about sharing my screen for our next portion, which I'm sure everyone is very excited for, which is that behavioral health transformation and just that information on BHSA. Let me get that up and going. Everyone see my screen okay? Yes, great. All right. So today we're going to talk about California's behavioral health transformation and the Behavioral Health Services Act, or BISA for short. So we're going to share with you how BISA funds some of our department programs, some new requirements of the Act, and how you can participate in giving feedback on the BHSA plan. So to start, it might be easier to look at BISA from a larger lens so you can see the big picture. So this slide shows how the state sees BISA integration into the larger system of care at the community level. So when seeking any health care, you normally don't start with a specialist. The behavioral health transformation defines public behavioral health as now specialty care. So this is important, and this emphasis on public behavioral health as specialty care is at the center of all the coming changes. So this means that mental health prevention, mild and moderate mental health needs are designed to be met in the general healthcare system, like with your primary care doctor. Substance use prevention remains within substance use treatment systems, but BISA also encourages greater integration and partnership in addressing behavioral healthcare needs across the continuum of care. So the goal is to make care access and provision more efficient by eliminating the wasteful repetition that can sometimes come from silos of care. So it's to have more comprehensive engagement in all care environments and to optimize the use of state and county resources. BISA wants to make sure that BISA funds are not used to pay for services that Medi-Cal or commercial payers are obligated to cover. So the Behavioral Health Services Act, or BISA, is the updated version of the Mental Health Services Act, or what we call MISA. So following the passage of Proposition 1 in March of 2024. So BHSA continues to be funded through that 1% tax on personal income over $1 million per year. And the goal of BHSA is to modernize how California funds and delivers behavioral health as specialty care. So it shifts the focus to treating behavioral health as specialty care while moving broad public health prevention efforts to primary care providers and managed care plans. And this transition aims to create a more integrated, coordinated system that meets people where they are and provides care that is timely and culturally responsive. So the BHSA reallocates funding from 5 components that we're currently in MHSA to 3 components in BHSA. And so those 3 components are housing interventions with 30% of the allocation, full service partnership with 35% of the allocation, and behavioral health services and supports with 35% of the allocation. And we'll break those down into further detail later on the slides. So guiding principles of the legislation shape the goals of the law. There's been a philosophical shift that focused on maximizing funding and efficiency and reducing homelessness and getting people off the street and increasing accountability over the funds. So here's some of the other changes that are included. So I'll just go down the list, but BHSA has a stronger position on the use of the funding as a last resort. So providers, both county and contractor, are expected to be Medi-Cal certified, focus on serving the Medi-Cal population, and bill for all appropriate services before utilizing BHSA funds. BHSA also has increased focus on homelessness, especially encampments and serving the chronically homeless. Under MHSA, counties had greater independence to select programs and services to include in the plan. Under BHSA, the state has prescribed and required specific programs and practices and has increased the level of oversight and accountability. And the next one, so MHSA focused on people with serious mental illness, BHSA expands that to also include people with serious substance use disorders. And the primary goals of MHSA were to reach people before they had consequences of severe mental illness and to promote mental health recovery. BHSA focuses more on addressing the consequences of SMI and intervening to prevent symptoms from getting worse. Under MHSA, early intervention services were designed to prevent the onset of serious mental illness. And under BHSA, early intervention services are designed to prevent disorders from becoming severe and disabling. And lastly, under MHSA or MISA, outreach was more general to increase mental health awareness and reduce stigma. With BHSA, outreach is more about reducing barriers to seeking care and connecting people to services. So stigma reduction is no longer a fundable activity. BISA wants to make sure that we target people who have Medi-Cal or would normally qualify for Medi-Cal or who are indigent, generally the community members who have those fewest resources. So eligibility criteria for BISA services align with Medi-Cal specialty mental health services criteria and include individuals with substance use disorders. And for children, youth, so age 25 or under, and also for adults and older adults, the criteria is the same. So they have at least one diagnosis, or those who meet specialty mental health care access criteria, or have at least one diagnosis of a moderate or severe substance use disorder. So those criteria and eligibility are the same across the whole lifespan. And BHSA also requires counties to prioritize I'll just call it what it is, BISA services. Not trying to repeat that, the acronym, but BISA services for the populations listed on the slide. So that includes the chronically homeless or those who are experiencing homelessness or at risk of homelessness, those who are in or at risk of being in the justice system, those who are reentering the community from prison or jail or a youth correctional facility, at those at risk of conservatorship or in the child welfare system, and also those at risk of institutionalization. So there are two reporting documents in BISA, the Integrated Plan or the IP, and also the Behavioral Health Outcomes Accountability and Transparency Report, or called the BOTR. So the MISA plan required one planning document and one accounting document, and both of these were due annually. BISA requires the planning documents or the IP to be completed once every 3 years, and the accounting document, the evaluation one, the BOTR, is due annually. So the IP is to primarily report on BISA-funded programs and some additional programs that are specifically identified in the legislation. The BOTR is a report on all department funding and programs regardless of funding source. So this includes BISA funds, general county funds, grants, and also realignment dollars. So like MISA, the BISA integrated plan requires a community stakeholder planning process. Stakeholders under BISA are more readily defined in the legislation and directs the county to work in a more integrated fashion with other large organizations like the Public Health Department. So for example, BISA requires county behavioral health to collaborate with public health on their community health assessment or the CHA, and also their community health improvement plan or the CHIP. So this is a large community health assessment and intervention plan that was always required of public health, but now BISA will mandate that behavioral health become part of the governance of the planning and also implementation. And this plan will now align with BISA planning cycles and will take place every 3 years. And timeliness in meeting deadlines and adhering to the regulatory requirements are essential, and if not met, can result in the state issuing monetary sanctions on the counties. So the authors of MISA established a regulatory required community stakeholder process that included MISA education, a designated 30-day comment period on the annual draft plan, and a public hearing conducted by the Behavioral Health Commission. So this was an annual process that coincided with the annual plan requirements. So BISA has retained much of this concept and has aligned it with the integrated plan process of once every 3 years. BISA has expanded the list of required stakeholders, as you can see listed here on the slide. And the collaboration with public health and managed care plans are also now part of this expanded engagement. So the state expects to see quote unquote meaningful engagement with BISA target priority populations and those that serve them. This includes also that education about what BISA is, as well as the planned services. DHCS is focused on building bridges across public health, managed care plans, and also behavioral health delivery systems with the goal to increase cross-system collaboration and also shared funding. So I'm going to take it over to Andrea now to talk more about that breakdown of those new 3 components and what that might mean for Riverside County, or what that does mean for Riverside County.
Thanks, Mindy. So beginning on July 1st, 2026, prior to the state distributing local funds to counties each month, 10% of the total annual revenue from the State Behavioral Health Fund will be allocated to the state level for initiatives. Under MISA, that was previously 5%, so they've increased that off the top allocation. This slide breaks down what that 10% allocation looks like to the state-directed funding. You'll notice that BISA reallocates prevention funding as a state-directed activity. So again, that means that prevention has been removed from local planning and implementation. So what does that mean for Riverside County? Counties are prohibited from using BISA funds for stigma reduction programs that are aligned with population-based prevention activities. Population-based prevention programs may no longer be funded with local BISA funds starting in July of 2026. The most significant change is that prevention funds will be administered by the California Department of Public Health. You'll often see that referred to as CDPH. At this time, it's unknown how CDPH will manage those funds. They're currently analyzing stakeholder feedback, and we hope we'll make an announcement regarding their planning soon. Riverside mental illness prevention programs and campaigns that no longer meet BHSA criteria will sunset on June 30th, 2026. These programs include stigma reduction, mental health awareness, parenting and or family or other support programs focused on non-specialty mental health or non-Medi-Cal community members. BISA does not allow counties to spend funds on coalition activities such as the Suicide Prevention Coalition. Our department, however, remains committed to suicide prevention and working closely with our partners in public health to continue to seek other funding opportunities to maintain some of those activities. Next slide. After state-directed funding, remember that 10% that's taken off the top, the remaining 90% is allocated to counties and is required to be spent according to this component breakdown that we see here. So 30% must go towards housing intervention programs, 35% must be spent on full service partnership programs, and the other 35% must be spent on behavioral health services and supports. And now we'll go into each of these 3 components in a little bit more detail. So first up is housing. A housing intervention is housing assistance and supportive services that help people with a diagnosis achieve housing stability. Eligible individuals must be living with a serious mental illness and or substance use disorder and be experiencing homelessness or be at risk of becoming homeless. Funds are used to provide subsidies related to housing and providing supports to maintaining housing. Rental subsidies, housing supports such as deposits or supplies needed for home, pest control, things along those lines. These funds cannot be used, cannot be used to fund mental health or substance use treatment services, but must connect members to services. We can also not use housing intervention funds for benefits that can be paid for through managed care plans. BHSA will support the Mead Valley Wellness Village, which will include 90 adult residential facility beds and 299 transitional living apartments. Riverside also already has a robust housing development under MHSA and other grant opportunities. A part of Prop 1, the proposition that contained BHSA last March, also included a residential housing bond measure. Riverside County has successfully applied for and was awarded in the first round of bond dollar applications. One project is a new county psychiatric hospital with expanded bed size and a better ability to treat children, which will be located next to the medical center in Moreno Valley. And another plan is for children's and youth residential campus, which will be next to Harmony Haven in Beaumont. The next component is the full service partnership or FSP component, and 35% of BISA funds, again, must be directed here. Programs must include substance use disorder and or co-occurring treatment services. BISA requires that every county implement 2 levels of care for adult and older adult FSPs. The highest level of care is an evidence-based practice called ACT and FACT, and we have to implement that program to fidelity. And again, that program is both for adults and older adults. And the other level of FSP care, level 1, is intensive case management or ICM. This is a level of care beyond standard outpatient care. It's designed to be less intensive as FSP care. FSPs are also required to include something called individual placement and supports, or IPS. This is a vocational rehabilitation model of supported employment for people with serious mental illness. Pursuant to BISA, county FSP programs must begin implementing IPS services starting in July of 2026. Children's FSP is limited right now to something called high fidelity wraparound. Although other options continue to be explored by the state, but as of right now, high fidelity wraparound is the only children's FSP in the current regulation. BISA requires counties to offer low barrier access to medications for addiction treatment, or MAT, and prioritize those who are at risk for overdose or experiencing homelessness and/or justice involvement. Behavioral health utilizes navigation teams to connect individuals to MAT services via the Emergency Department Bridge program. Our psychiatry residency program also works alongside HOPE, our HOPE program, to provide MAT to homeless individuals in the community. And the last component that we're also required to allocate that remaining 35% to is called behavioral health services and support. And this category includes children's, adult, and older adult systems of care that are not covered under the other two components, outreach and engagement, our workforce education and training needs, capital facilities and technologies that are not housing developments, early intervention programs, and innovative behavioral health pilots and projects. So you'll often lovingly hear us refer to this as the kitchen sink component. Communities or counties may use a portion of BHSS funds for outreach and engagement. BHSS funds may be used for activities intended to reach, identify, and engage individuals, families, and communities in the behavioral health system and to reduce disparities. The focus is engagement and linkage for Medi-Cal recipients who need specialty mental health level of service. 51% of the BHSA component dollars must be spent on early intervention services, and 51% of those dollars must be spent on youth ages 25 or younger. BISA changes MHSA's definition of early intervention. Under BISA, early intervention is the proactive approach of identifying and addressing behavioral health concerns in their early stages before they escalate into more severe, disabling, or chronic conditions, and to reduce disparities in behavioral health. This can include crisis system of care services. County early intervention programs target BISA priority populations that Mindy shared with us earlier and have the goal of identifying these individuals for access and linkage to service and treatment as needed. BHSA also mandates that counties fund something called the First Episode Psychosis Program. It's an evidence-based model geared towards TAE who've had their first psychotic break. RUHS Behavioral Health already operates this program countywide. So what does this mean for us here in Riverside County? Firstly, it means that we don't expect a reduction in terms of services available in our outpatient system of care. With BISA and BH Connect, we will be adding to our services some of the BHSA required evidence-based practices. This includes functional family therapy and multisystemic therapy, as well as expanding our PCIT services. We anticipate that workforce education and training programs will also remain in place. 9 programs currently funded under MHSA PEI meet the regulatory requirements for early intervention under BHSA. These programs will continue to be funded. All early intervention service providers must meet new BHSA regulation, which includes obtaining Medi-Cal certification. Some current contractors of those listed programs that are here on your screen may choose not to continue under these new regulations, so RUHS Behavioral Health is working closely with our partners to support compliance or identify alternatives. So far, these contractors have shown an interest in making these modifications to maintain their status as a provider under early intervention with BHSA. This is the timeline that we are currently preparing for and working in. We're in this early part, September to December of 2025, in this community stakeholder planning process. Our really big change comes on July 1st of 2026, when we have that new requirement for the integrated plan. And then lastly, we'll share with you in a moment a QR code, but first I wanted to make sure that you all know that there are some other ways that you can participate in the stakeholder process. There are 2 formal opportunities for the community to express their opinions on the plan. The first will be a 30-day public posting of the draft plan. This will occur during the first quarter of calendar year 2026. We're aiming for January. The plan will be posted on the department's MHSA webpage. They're currently working on a BHSA version, and feedback can also be provided electronically. The next opportunity is providing written or verbal feedback at a public hearing, which is conducted by the Behavioral Health Commission. To coincide with the in-person public hearings, we will also have virtual public hearings like we've done for the last number of years under MHSA. Public hearing videos will be available in English, ASL, and Spanish and posted 24/7 for a 3-week period that coincides with those in-person Behavioral Health Commission public hearings. Feedback can be provided electronically or by calling a dedicated voicemail hotline, which you see there on your screen as well. And these hearings will probably take place in February of 2026. If you'd like to provide feedback now, you're able to do so by scanning the QR code on your screen. It will link you to a brief survey and allow you to write out your thoughts as well. Thanks for coming to listen about all of the big changes that are coming our direction. If you have any questions or comments, Mindy and I are happy to do our best to answer them for you now, but I can't promise you we'll be able to answer it, but we will make sure that we take it to the people that can answer it. All right, this is the time we like. Oh, dang it, Carmen. I was just going to say we like a quiet audience when it's time for questions.
Sorry, Andrea.
Hi, Carmen.
You know I have a lot of questions,
I
but
know.
just looking over your timeline, will you be releasing an RFP to continue services beyond, like, for us, we provide pearls and CBT. Are we going to have to submit like a new proposal to continue offering those services?
No, not at this time. We can give you some more information about what that timeline in regards to contracts that will be continuing can look like. But as of right now, in the immediate, like next 6 months, no. But I can talk more about what that timeline will look like with you and Dan.
Okay. And then we're still kind of figuring out if becoming Medi-Cal certified makes sense. There's a section in becoming certified that asks for a lot of information from our board of directors, but we kind of don't know if unless we get more information on like the specifics, auditing, is that going to change based, the current auditing that happens now with cost reports, CMT, how is that going to look different? And then also reimbursement, right? Billing for these services in this new VHSA model, how that looks like. Do you all have any more information on that? And then also, when would you need to know, like, do you have a deadline of when you need to know if we are going to be moving forward and getting Medi-Cal certified?
Okay. So I just want to make sure I got your questions correct. One of them is regarding RFPs, and I can share more about that with you and Daniel. The second one is related to kind of auditing, cost reporting, CMTs, like what that process will look like, along with reimbursement and billing. So I can say that auditing will continue to happen. Cost reports, as far as we know, will not, because these will not be actual cost contracts. They will be like unit cost. And we have a meeting on calendar with our good friends in QI to help us answer some of these questions that came up during our transition meetings. And that meeting is in a week and a half, 2 weeks. So we expect to have more information about all of the things that you and many of our other providers asked us. So we hope to have more information on some of those details in a couple of weeks. And then I will also we'll ask Diana when we need to know whether or not an agency is wanting to continue. So I have that down for you as well. Did I miss anything, Carmen?
One more question. I saw in the slides that you were going over that there may be funds for pilot programs,
Mm-hmm.
right? Would we share with you ideas, or are you doing like another process for that on other potential programs that maybe we could offer? You know,
Okay.
or are those funds being kept in-house, through RUHS? Because I'm sure you probably have other programs that you're interested in possibly doing.
Okay. Got it. We will take that to Diana and see if we can get an answer to you for that question as well.
Great. Thank you.
You're welcome. Thank you. And I thought I saw Dory. Yes, ma'am.
Andrea, yeah, so how do we become Medi-Cal certified?
Good question.
How long does the process take and how early can we start the process?
Okay. So that I think we'll get more detail around that question in particular in the meeting we have with QI in 2 weeks. But from what we've been hearing, that our department is actually able to certify providers as Medi-Cal providers, and so the process might be faster than we knew about beforehand.
Okay, thank you.
Yeah, so we'll have more information in a couple of weeks.
Okay, thank you.
Are there any other questions that we can attempt to answer?
No question, just a comment. I think, this is a big change for all of us, and I personally appreciate your department's, kind of thoughtfulness in having these types of presentations for us, and also in being willing to work with us. So appreciate that for sure.
Thank you, Carmen. We'll make sure Diana hears that feedback as well, because you're right, it is a big change for everyone. And we appreciate all of our partners in working with us as we navigate this change and we all learn together.
And I see a comment from Donna in the chat. It's that it's hard to from the presentation to know what the losses are to the county by way of programs and populations not served or provided. We do know how that directly impacts our programs here in PEI. And we do have a list in our notes that we're happy to share what those impacts are. Or should I read them real quick?
Sure, and then I can put them in the chat as well while you read them.
Okay.
Do you have a report maybe that you can share with us?
What was that, Carmen? Sorry.
Is there a report that maybe you can share with us that shows us these impacts?
So we do currently right now have a list of programs that we know will no longer be eligible under BHSA funding. They don't meet the criteria for early intervention. And that's the list that Mindy's gonna read out and I'm gonna put in the chat so you can see, and that's only in regards to PEI programming. We expect, as we said in our presentation, to actually not see a reduction in our outpatient clinic service delivery, since there are new evidence-based practices that the state requires that we implement under BHSA. So it's like we'll see a reduction because prevention programs are no longer fundable. So we are losing programming as part of PEI. However, our county clinics will also see an expansion of services for Medi-Cal recipients under those new evidence-based practice requirements, if that makes sense. But we're going to put the list of PEI programs in the chat for you, and Mindy's going to read it out as well.
Yeah, so I found the list of programs that will no longer be funded in Riverside County that are impacted by the changes in regulations under BHSA. So this includes the Asian American Pacific Islander Mental Health Resource Center, the Promotores Program, Community Mental Health Promoters Program, the Wellbriety and Celebrating Families Program, Gathering of Native Americans, or the GONA, with that as well, Keeping Intergenerational Ties in Ethnic Families, or KITE, our Dare to Be Aware Youth Conference, Stand Against Stigma presentations, the TAY Peer-to-Peer, our Cup of Happy program, Active Minds, which is the Sin Silence Packing events, Man Therapy, Triple P Positive Parenting program, the Strengthening Families program, or SFP, Outreach and Reunification Services to Runaway TAY and our Safe Places, Care Pathways and Caregiver Support Groups, Mental Health Liaisons to Office on Aging, and the CareLink program, or Healthy Ideas. So all of those, as of June 30th of 2026, will sunset.
And all of the providers that are current PEI providers for those programs are aware of that change. We notified them and had meetings with all of them in August of this year. So everybody is in the loop around that, but it is a significant shift for our community. We agree. The list has too many characters. I'm trying to shorten it and put it into 2 different messages. So give me 1 second, y'all. Sorry about that. It's It's a lot of letter characters, and the Zoom chat didn't like that. Other questions or comments?
This is Dakota. I have a question. Is it possible that the state will be picking up some of those then?
Some of which, Dakota,
Like the caregiver pathway, um, the
so the
promote.
state is picking up the prevention, population-based prevention. As we mentioned, we don't know exactly what that will look like yet, but California Department of Public Health will be the one in charge of kind of overseeing the prevention efforts at the state level. We just don't know how they'll be spending those dollars, what that will look like. They have been having listening sessions over the last little while and gathering feedback from the community, from the stakeholders throughout the state. We were hoping to have an update from them in October. We haven't yet had anything come out, so we're hoping it will be coming in the very near future about what that will look like in regards to how that will look at the state level.
Thank you.
You're welcome.
I
Sorry,
think
I'm trying to multitask.
Oh,
You can get this other part of the
I
list
think
out.
I think there was some of the list that I didn't have on my list. So I know, like, I didn't mention,
There
I
we go.
think the Up to Riverside um campaign, the website, the Suicide Prevention Coalition. And Donna, I see your hand up and I saw your follow-up question in the chat. Yes, Donna.
Yeah, I was just, excuse me, I was just asking about the cultural liaisons. Will those continue or not?
I believe our cultural liaisons are going to be part of our, I just lost the acronym in my head, but our eating disorder intensive outpatient program, since that has a cultural focus. I believe our liaisons are part of that process, as well as the larger stakeholder process for community planning, since we do still have our underserved cultural populations in our county, as well as directed at the state level. Our liaisons are going to really be integral in that larger community stakeholder planning process too.
Thank you.
You're welcome. Thank you for your question. And then I saw another question here in the chat, if a county can ask for an exemption to BHSS requirements to include a program that has been eliminated. If it is the only program targeting a population, Roberto, that's a great question. I'll go ahead and add that to our list of questions that we'll take to Diana, our manager, and see if we can get a response for you. And then Carmen, are there efforts to try to find funding for these programs by RUHS? Another good question. I know that we've been talking with public health around being able to continue funding some of our suicide prevention activities. I'm not sure if there's been conversations beyond that. We'll add that question to the list as well. Other questions? Donna, did you have another question or?
Not really a question. I just made a comment.
Oh, yes.
Just in looking at this quickly, it seems like a lot of the ethnic population type programs are not covered, which is very concerning.
Yes. It is a very big shift kind of in that foundational framework from the state level around what community or county mental health is. Like our population is shifting, really. That's what they're telling us is we're specialty mental health care now. So it is a very big foundational shift. We're also very concerned about our cultural populations. We know how valuable our evidence-based practices and community-based practices are for our local area, for our cultural populations, our underserved populations, and we share your concern.
Thank you.
Any other questions that we can take back? Okay. Thank you so much, everyone, for your very thoughtful comments and questions. And no, this is, again, not your only opportunity to ask. If you think of something later, we recognize this is a lot of information to digest if it's the first or maybe even 10th time that you've heard it. And so if questions come up for you later, you're welcome to reach out to us, either myself or Mindy or even Diana directly with your questions. And we'll, again, make sure that we work diligently to get answers over your way.
All right. So with that, we're going to then transition to our next one, which is our program spotlight. for Triple P, Positive Parenting Program, which, as we're kind of talking about all these changes with BHSA and what's to come, it's like we still have a good, what is it? We say 8 months left to take advantage of these wonderful programs while they are here. And I'm very excited to share with you about all the work that our provider has been doing over the years with the Triple P program. So that's what we're going to kind of shift our focus to today for our afternoon. So the goals of this program are to increase positive parent-child interaction, increase parental confidence, and also increase resiliency and skill development for children, parents, and guardians, including grandparents and caregivers in our underserved communities who are at the highest risk for development of mental health challenges. Our provider who is for this contract is the Carolyn E. Wiley Center. They've been providing Triple P services in Riverside County for the past 14 years and are currently in their 15th year of service delivery. So I'll be introducing you to some of the team here in a little bit, but first I wanted to provide you with an overview of the program and contract goals and the outcomes that we've seen in Riverside County with Triple P. So the Triple P parenting program is provided in a group format over the course of 8 weeks for free. I want to emphasize it is a free program, as all of our MHSA programs are. These programs are offered both virtually and also in person and are available in both English and Spanish. The structure of the group starts off with the initial 4 classes that's focused on educating and teaching about what positive parenting is, how parents can help their children develop, how to manage misbehavior, and how to plan ahead to decrease challenging behaviors from occurring. Homework is part of every class so that parents can try out the different strategies. These classes are then followed by 3 one-on-one telephone consultations with each parent and the facilitator. The parents set the agenda for these calls, and it is their opportunity to discuss how the different strategies are going at home and explore ways to fine-tune strategies to best meet their needs. The Triple P curriculum places a high emphasis on self-regulation and also parental competence, so focused on teaching parents skills to become independent problem solvers. Because the program is time limited, we want parents to develop self-sufficiency and also parental self-efficacy. So self-sufficient parents have the resilience, resourcefulness, knowledge, and skills to parent with confidence. And parental self-efficacy refers to a parent's belief that they can overcome or solve a parenting or child mismanagement problem. So to help parents develop these qualities, the program promotes self-management, including self-evaluation and monitoring, personal agency and problem solving. And the final session is where all the parents in the group come together to review and recap the different strategies learned and also to celebrate the completion of the program. The 2 Triple P programs that are offered are parenting for children ages 2 to 12, referred to just as our Triple P program, and also parenting for adolescents ages 12 to 16, which we refer to as Triple P Teen or Teen Triple P. The contract goal is to serve 720 parents countywide or 240 parents in each region of Riverside County. So that's been expanded, and the provider has just done wonderful things to rise to the occasion to serve more of our community and more of our parents. All right, so I want to go over now some of the program outcomes that we see with Triple P. And I like this little quote. Parenting is not about controlling our children, but about teaching them how to control themselves. And the data we're going to be looking at is from 23-24 fiscal year. I know that we don't quite yet have those reports for 24-25, but we see these trends across the years of program implementation. So just kind of like a large view with enrollment and demographics, that countywide Triple P and Triple P Teen or Teen Triple P combined served 686 parents in this fiscal years of 23-24. 261 were from Western region, 236 from Mid-County, and 189 from the desert. And by program, Triple P served 520 parents and Teen Triple P served 144 countywide. For demographics, we have a little chart here, and this information shows that most of the parents in Triple P spoke English as their preferred language, about 72%, and in Teen Triple P, 62% of those identified English as their primary language. And the majority of parents served in Triple P and Teen Triple P were Hispanic or Latinx, 64% and 71% respectively. The average age of childhood focus for triple P was 6.3 years, and for our teen triple P, it was 13.5 years. And the majority of parents or caregivers enrolled in both triple P and teen triple P programs were female. We saw close to 80%, which means also that there was close to 20% that were males. So there's that some information. And service data showed that countywide, over 80%, it was 80.8% of parents completed the triple P program, and 84% of parents completed the teen triple P program. So across both programs, parents had 81.5% completion rate, which is very high, and parents were overall very satisfied with both programs. So we'll go over some of the measures that are used and what we see from those. So one of the ones that we use for triple P is the Alabama Parenting Questionnaire, or the APQ. And this assesses several dimensions of parenting, positive and negative parenting practices that are the target of many parent management interventions. So this is a 42-item self-report measure filled out by parents using 6 parenting constructs. So for the triple P program, only the positive parenting, or 6 of those items, are used, and also for the inconsistent discipline. Those are other 6 items that are used. So we kind of look at this APQ measure in the frequency in which parents are engaging in particular parenting practices. And so countywide, we saw a statistically significant increase for practicing positive parenting skills. And after parents and caregivers have completed the triple P program, we also saw in each region that showed a statistically significant increase in positive parenting skills as well. And across all 3 regions, there was a significant decrease in the use of inconsistent discipline practices after completing the program. The next measure is the IBERG, or the ECBE. So this is a parent-completed rating scale used to measure both the frequency of children's disruptive behaviors and the intensity. So we see the parent's perception of the problematic behavior as like the problem scale, and then the frequency, or how, like, I guess, troublesome or how bothersome, how much of a problem they are, as the intensity scale. So the ECBE consists of 36 items to assess those typical problem behaviors, and each of those is rated on a scale of intensity. So countywide and across all 3 regions, individually, there was a statistically significant decrease in child problem behaviors from pre to post. So for the ECBE intensity scale, we have a cutoff score of 130. So we have a cutoff of what would be kind of considered like a clinical level that meets that threshold where it's like considered to be more problematic. So by the post, there was a decrease with only 9.5, or sorry, at baseline, there was 26.8% of children that had a raw score of above 130. But by post, there was a decrease with only 9.5% of children who then had that raw score cutoff of above 130. So that means that about 90% of parents were below the clinical cutoff after the end of the program. And from the ECBE average problem scale, there was a statistically significant decrease in the parents' perception of their child's problem behavior, or to view that behavior as a problem countywide and across all 3 regions. So the clinical cutoff for this one is a score of 15. So at baseline, so before the program started, about 33% of parents' ratings were above that clinical cutoff score, indicating that they viewed a lot of those behaviors as problematic. However, at the end of the program, it was decreased to only 14%. So that means now 86% of the parents were now below that clinical cutoff level after the completion of the program. That was a great shift in not only, I guess, the intensity of behaviors, but we always know that we say like parents are the problem, but not really. But I mean that what we see or view as problematic has also shifted. So these things are what we see across the years of the program outcomes. And so we also have for triple P the DAS, or the Depression, Anxiety, and Stress Scale. So this is a 21-item questionnaire, which includes 3 self-report scales designed to measure the negative emotional states of depression, anxiety, and stress. So in completing the DAS, the individual is required to indicate the presence of a symptom in the previous week. And so each item is scored from 0, so did not apply to me at all, or 3, that it applied to them much or most of the time over the past week. So all 3 regions in Riverside County scored in the normal range for the DAS depression scale and the pre-measures. There was also a statistically significant decrease in reported depression symptoms for those post-measures as well. So we saw decreases countywide in those scales of depression, anxiety, and also stress with our parents. So shifting now to our teen triple P, we have some measures that we use for this one. Some are the same, like the Alabama Parenting Questionnaire, but we'll start with the Strengths and Difficulties Questionnaire. So this is a behavioral screening questionnaire designed for children and adolescents up to 17 years of age. Each of these 5 scales of the SDQ looks at emotional, conduct, hyperactivity, peer problems, and pro-social behaviors, and are scored on a scale from 0 to 10. So 4 of the scales, which are the emotional, conduct, hyperactivity, and peer problems, create a difficulty score. And the emotional and peer items together also create like an internalizing problem score. And the conduct and hyperactivity questions create an externalizing score. So key findings from the analysis of the pre to post SDQ data indicated that there was a decrease countywide in those internalizing and externalizing problem scores, as well as in the total difficulty score. So it was a significant also improvement countywide with the pro-social scores. So the ones that we wanted to see decrease did decrease significantly. And those areas that were in the realm of pro-social behaviors, we saw a desired increase in those. And then we have the Alabama Parenting Questionnaire also that we use for the teen class. And so key findings from this was that pre to post, we did see also that increase countywide in parental involvement and positive parenting, and we saw that decrease in poor monitoring across the county. And finally, the last measure that we look at and use for our Triple P teen program is the Conflict Behavior Questionnaire, or CBQ. So this is a 20-item questionnaire that uses a true-false scale to assess general conflict between parents and their children. And results showed a statistically significant decrease or improvement across all regions and countywide in parents' ratings of general discord between the parent and the teen youth. So it was also great to see, and we see just the drastic drop in change here. The purple was being the pre-measure and the blue being post-measure. So how those conflict scores decreased drastically. So now we're going to talk about Triple P in action, and I'm going to now turn it over to some of our team members from the Wiley Center that are here to talk about the program. So I have a picture here from Summit just to meet the team. I know the pictures in print there are very small, but these are just the team, so we can see them here. And I know we have Rosie Espinoza, our program coordinator, on the call. So I'm going to turn it over to Rosie to talk about some of the session components. And Rosie, if there's anyone else on the team that was able to join, if you want to have them introduced, you're more than welcome to.
Okay, hi Mindy, thank you. Yeah, we have a few on here. If you want, just want to introduce yourself. We have, let's see, we have Yesenia, which is well, I'm gonna go ahead and have her introduce Yesenia if you're able to log in.
Um, can you hear me? Hi,
Yes.
everyone. My name is Yesenia, and I am the facilitator for West Region, and I do both Spanish and English. So I facilitate both the English and the Spanish classes. So thank you.
Thank you, Yesenia. And then I know we have Azucena here.
Yes, hello everybody. Hope everyone is doing well. My name is Azucena Munoz. I am part of the Desert region, but we support Mid-County, West region. I also do Spanish and English, teen and children.
Thank you, Azucena. And then I believe we have Isabel here as well. She can.
Hello, yes. Hi, everybody. Rosie, can you hear me?
Yes, we can hear you.
Okay, hi, everybody. I'm Isabel. I'm from the West region of the Triple P program. Um, this program is great for our families in the community. I know we kind of target families that deal with CPS most of the time. A lot of the time, I feel that parents reach out to me and just let us know how this program really impacts their lives as far as not just building that support group for them, but also giving them that sense of hope. Um, yeah, I love the Triple P program and what we're about, what our mission is about, the sense of community and camaraderie that we have within our team, and within our community. So nice to meet everybody. Thank you.
Thank you, Isabel. All right. And unfortunately, the rest of the team wasn't able to make it. They either have class, they're teaching a class, or they have phone calls. So, but like Mindy said, here's a picture of the whole team. And yeah. And like Mindy said, I am Rosie Espinoza. I am the program coordinator for the Triple P program here at the Wiley Center. So we're just gonna go over a little bit of the program overview. I know Mindy kind of touched a little bit about it a little bit earlier. But this is kind of the breakdown. So you could see the breakdown here. We offer two different classes. So we offer the Triple P 2 to 12 class, which is for parents with children with ages 2 to 12. And then we target our teen population. So parents with teens 12 to 16. Um, we offer both classes either in person or online. These are ongoing classes that we constantly have, especially the online ones. So as soon as we have enough parents to fill these classes, we do need to have about 6 or 7 parents to begin a course. So once we have that, we look at our interest list, we start, scheduling these classes for the parents that have registered. And so, as you can see here, they're kind of pretty much the same. They're both 8 weeks long. The breakdown is again the same. So session 1 through 4 is the facilitator giving you all the strategies, all the content from Triple P. This is an interactive class, so you do get put into groups with the other parents. You get to learn from the other parents. And then session 5, 6, and 7 are actual phone calls. So you don't meet with your you don't meet as a group. You just choose, the parent chooses a specific, their specific time that works for them. And the facilitator then calls that parent. They have that one-on-one time to go ahead and talk about how things are going. After the 4 sessions, it's kind of like, okay, this is what you learned in the class. What works best for your family? What would you like to apply within your family? And so those phone calls are that one-on-one time to go ahead and speak with your facilitator about what's working, what isn't, if you have specific questions, if you need different resources, that's more of that one-on-one time. So that is session 5, 6, and 7. And then finally, session 8, you come back as a group, and that is, closing out the program, some things to go over, some things to keep in mind as the program ends. And same thing with the teen. Same breakdown as far as the session 1 through 4 are all together as a group. 5, 6, and 7 are phone calls, and then the program ends at session 8. So just a little overview about how that is broken down to. And then we can move on to the next one. There we go. And then I know Mindy had already mentioned we do service all of Riverside County. So these are some of the cities that we service. We do get a lot of our parents from partnering up with our school districts. So we have been blessed to have a lot of contacts at the school district level. So that's usually how we get our word out, where we get our parents from. We have opened it up recently to CPS parents. So any parents that need this class for reunification purposes. This something to keep in mind is that our classes, not only are they free, but they are also CPS and court certified. And so that's usually how we get our parents. We do have a general interest form, but we do work a lot one-on-one with each contact of each individual district, and they choose their dates and whether they want it in person or online, and they help us, share our flyers, and then that's how we get parents to sign up for our classes. And some program incentives. So During our classes, whether online or in person, we parents do receive a free workbook. Like I said, it's interactive class, so they're going to be following along. Everything that we show within the strategies, our slideshows, our videos during the class, everything is in their workbook, so they get to follow along with their free workbook. Um, if they are in-person classes, we do offer childcare if needed, as well as for in-person classes, we offer any refreshments, any snacks for parents and children attending all of the in-person classes. And at the end of the program, parents who have graduated the program, so parents do have to attend at least 6 out of the 8 classes to be considered, graduates of the program. So the ones who do graduate, obviously they receive their certificate of completion as well as a $20 gift card. And then during session number 4, we also do like a little raffle for attendance. So all the parents who attended all sessions 1 through 4 get put into this raffle, and then we pick a parent and they also receive another $20 gift card. So these are some of the incentives that we provide within our class.
Thank you, Rosie. Let's
Thank you,
see.
Mindy.
Yeah, that was great. And then I'm going to also just follow up because I know that you talked about program incentives, but also I wanted to share about just the wonderful things that that parents take with them and the knowledge that they learn. And so I wanted to share about the program testimonials that were gathered from the surveys that were completed. There was a total of 560 surveys that completed, so participants that did complete the satisfaction survey at the end for both programs. And overall, the majority of participants were highly satisfied with all aspects of the program, including logistics, quality of group leaders, and also just overall satisfaction. So when asked what they learned from the program, some of the parents, I know this is probably very tiny on some screens, so I'll go ahead and read it. But some of the programs from the Triple P 2 to 12 program shared that they learned to praise. The power of praising is definitely a great way to be a positive parent and encourage the behaviors and tasks we want our children to follow. Better ways to discipline my child based on proper expectations of their age. I learned that my behavior is a really good way to start positivity in our household. Also learned that slowing down translations, oh, sorry, I think it was probably about transitions in our household for big activities helped us all to stay calm and get ready for morning and bed routine with less fights. And then also from the Teen Triple P class, parents shared that they learned that the behavior contract was good. And so how to validate my teen's emotion and what they do, praising the good behavior, to allow my teenager to calm down before talking to her, make sure to praise her when she's doing good. And both parents or parents from both programs also shared what they did like about the program. So one said, I really enjoyed goal setting, the videos, and the workbook. It was nice when other parents spoke with each other and offered advice. And it was a great to see my husband do better because of this. And another parent said, I like that there were parents willing to discuss their troubles and offer insight into things that they do or have tried. Also like doing the scenarios with the breakout sessions. So that's some of the past feedback that we've seen from the program surveys. And we also have a current program participant from our 2 to 12 Triple P program from the Coachella area that is here today to share about her experience in the program. So I'd like you all to please join me in welcoming Alicia. Are you here, Alicia?
I am. Hi.
Hi. Thank you so much for being here with us. I have some questions that you could hopefully provide some insight to for our group here, but what interested you in attending the parenting class?
Well, first things first, I am from the desert region in the North Shore area. We're mostly agricultural here. So this flyer was sent via Parent Square in my child's school. I usually go to most of their parenting, whatever they have, but unfortunately, most of the schools' interpretation of parenting is geared towards normal kids. And when I identify normal is because my son is super special. He is a nonverbal autistic 6-year-old child. So is he not going just through his regular 6-year-old issues, but then you add the autistic nonverbal communication and then me in there. I was like, you know what? I was very hesitant about getting it, but I was like, you know what? I have nothing to do on Tuesday mornings. I can do this.
Mhm. Awesome. And what have you learned as a result of attending the program so far?
You know what? Miss Rosie is fantastic. I have learned so much from the first session. I learned right off the bat that my son is basically training me instead of me teaching him. But when I learned that, at first it just mind blowing that the first class could give me such power because I did not realize that my son was teaching me how to yell louder. And it had nothing to do with his autism and it had nothing to do with his nonverbal. He just did not want to, help me. So things were, I realized how often he would wait until I got to that very perfect pitch, then he would listen to me. And I hated it because I didn't like yelling. But since the first time that happened, and then I was like, okay, so then she started teaching us about how to redirect, slow down, control the situation, um, the start and the stop routines, which were great. And then I didn't realize that, I yell from across the room. He's not looking at me when he's doing it. He's doing something else. And the second session, she told us the miracle of timers, which now I have all across all of my rooms because my little autistic child has so many things he has to do that I'm like, Miguel Angel, pick up your toys. 2 more minutes. He sets the timer. We hear the beep. That's it. That's the 2 minutes. So we slowly learned how to adjust ourselves. And not only that, I too. So when he asked me, Mommy, can we talk? I'll be like, 2 minutes. He sets the timer. As soon as the 2 minutes come, you know what? He holds me accountable. I sit down, no matter what I do, the dishes could do themselves later. I sit down and I listen to what he has to say. And, there's a lot less yelling.
Awesome. That's amazing. I know you've shared a little bit already, but is there any other, well, can you speak more about how the class has helped you and your family, just in the day-to-day or the changes you see overall?
You know what? I think that it has worked a lot because I have a 73-year-old mother living with me, a 20-year-old, I guess I want to say child because she is my child to some extent. She's my little niece, 20 years old, and then my 6-year-old autistic child, and I'm the 30-year-old here. So it's just such a big age difference throughout. But because they saw me with this class, well, first of all, they know that I have to put away time for this class on Tuesdays. And then I bring up, can you believe this is what my son is doing to me? He's training, he's teaching me. And so I tell them how we're doing things, or they see the reward board that we have. It's a white piece of paper, and he gets to choose the rewards at the end. And you know what? And recently, Miss Rosie, after our seventh session of a phone call, I told her that we reverted back a little because I forgot the praises, and I forgot about the praises. I was working on them so hard that seventh week, I forgot the praises. He started going back to his old habits. And I'm like, oh, I told him I was going to. So my son likes jumping on the couch, which is not safe. And I told him, if you keep doing that, I'm going to take the couch away. And she's like, well, you should do a consequence board where, he can tally himself how often. And if you have to remove the couch, he needs to learn that. And I was like, oh, you know what? I did not think about that, you know? But in general, all of my family we started to use the timers like crazy. So that's why we have timers in the living room, in the kitchen, in the bathrooms, so that he knows that there's a timer set for it. And it really works for bedtime, for wake up time, for putting his toys away, for eating breakfast, because it sounds so weird that you don't really notice this, how, you're being from a Hispanic family, when your parents said, do this, You get up and you do it exactly when they said it. You don't take your time to do it. But you never thought that maybe you had other things in your mind that you were doing, and you know, like it can cause some kind of, I guess, friction in the relationship. And I never realized that friction because, well, I have a Hispanic mother, you know, you know. But yeah, as I'm learning it, my niece and my mother that takes care of my son is learning it too because they realize that, you know. And there's a lot less yelling in my house. And even though my son is nonverbal, we understand each other to a certain connection, which, like I said, I've had other parenting classes and they don't translate into autism. And being nonverbal and this being positive, you know, positive parenting, I'm like, how would that translate to autistic? Because the positive side of it is the hard part because my son doesn't know a lot of words. So it's a lot of no jumping, no yelling, no this. So I had to learn it's not no yelling, it's inside voice. It's not no jumping on the couch, it's we sit on the couch. So, you know, it's a lot more words, and we have learned, we are starting to understand each other and communicate, you know. And that was something that me and him couldn't do because of that barrier that we had, that communication barrier, which it would only, he would listen to me when I escalated it to the top of my lungs and he knew the tone, and that's when he would do something. But I don't need to use that anymore, you know, because we have the timer tells us this is what we agreed upon, and now we're doing it because we have to be, you know, accountable for what we said we're going to do. And not only is he being held accountable as a child, but I'm being held accountable as an adult because the timer boat works both ways, you know. So it really helps us, you know, like we're a team. It's not like me against him or him against me, or, you know, the common child mother thing. It's more like we're in it together, let's make the most of it, and it really does help.
That's amazing. Thank you so much, Alicia. I love to hear how it sounds like the folks in your family, especially with you and your son, have really grown closer. And
We
there's like
really have.
more warmth or more it's like I can totally relate to the feeling of feeling like you're going around yelling at everyone in the house. So it's nice to know that like with these positive parenting practices that you and your family are learning how to kind of enjoy each other, or to know that there's expectations and just to set those limits and really nurture that relationship. That's amazing.
Yeah, I am very I'm very happy that I decided to, you know, join. Like I was telling Miss Rosie, I'm like, you know what? I feel like so many parents would benefit from this. And it's sad that it's only a flyer and it's an at will, like, oh, you know, it's like a shrug off unless you really want to go through the steps. And I feel like, wow, if they knew, because I feel like in this area at least, I could see how parents might be hesitant because it says that CPS stuff, you know? So I'm like, oh, I could see how that could worry someone, you know? But at the same time, I feel like this information needs to be shared. And I was telling Miss Rosie that I'm like, I wish that there would be more here in our area because being, like I said, an autistic parent, you think that none of this, you know, training really works or transfers over to them unless it's for special need kids. And now that this, it's like, oh, parenting is has all languages. It doesn't matter what you know, it transfers over to any child, any situation. So that was really nice.
Awesome. Well, spread the word, everybody. Alicia, just like share your story everywhere. That's so amazing. So yeah, spread the word and let's get it out there to more parents and more families. And Alicia, is there anything else that you'd like to highlight or say about the program?
I think that I want to highlight the importance of the book. I know that it's you guys give it for free, and I know that this program is free, you know, but the book really helped because, like I was telling Miss Rosie, I'm going through a setback on week 7. Like I was going back to my old ways, my son's going back to his old ways, and she was able to tell me like, oh, remember session 3? She was like, go and read it again. And I mean, even though my classes are about to end, you know, having that book and having it's kind of like a mini parenting Bible, I guess you could say, like, oh, just add it into the books of things that you have. And if you need to take it out, bring it out, you know?
Yeah. That's awesome. And it kind of reminds me about how the whole program is designed to help parents kind of be that problem solver, right? So using that parent Bible, I like that. We're gonna coin that now going forward. But using that parent Bible and looking back of what you learned and being able to then say, oh yeah, I know what I can do differently. So that's great. Would you mind if we take some questions from our audience for both of you, Alicia and Rosie?
No, go ahead.
Oh, okay, well, I just wanted to kind of open it up, and thank you, Alicia, for sharing. But are there any questions from our audience? I know I see lots of folks in the chat saying thank you for sharing your experience. I think Dakota was sharing she's curious about what time of day the classes are. Were you able to go, or sorry, I can't remember that. Were you able to get working parents to attend? So I think that might be a question for Rosie about just like time of day and the flexibility of classes and the schedule that's offered.
Yeah, hi Dakota. Yeah, we're pretty flexible. So depending on whether it's our online classes, usually our online classes are either from 9 to 11 in the morning or 5 to 7 in the afternoon. Now, if it's a specific class time that like the districts choose or the resource centers that we go and choose, they kind of choose the best time that they think is best for their parents. So we've had, classes from 12 to 2, or we have classes from 6 to 8 for Riverside school district. So it just kind of depends as far as like because we do need to have if it's going to be an in-person class, we do need somewhere, a space to like to teach them. So it's usually like the schools or the resource centers that offer a space for us. So they kind of choose their own time with that. Before our online classes, it's usually most popular times are 9 to 11 in the morning or 5 to 7 in the afternoon.
Perfect. Thank you. Are there other questions for Rosie or for Alicia? No? Okay. Well, I want to thank Alicia for being here with us this afternoon, and thank you, Rosie, for reaching out to your parents and asking them to come and share. I did want to also provide everyone here with the contact information. So if you'd like to share this information, or you yourself, or you know somebody that wants to take advantage of these wonderful free parenting classes while we have them available, we have Rosie's email up here and also her phone number and extension. And she did mention the interest list. So if you scan the QR code, it can take you to that as well. So you can connect or refer to the program. All right. And so I'm going to go ahead and stop share that. All right. Well, thank you so much. And so now we're going to transition to hearing about our suicide prevention activities for fall. Let me just change over my screens here and get that set up real quick. Okay, let me share screen. Okay. I think we're all set. I'm going to turn it over to Annie Marie Morales to take us through our fall activities for the Suicide Prevention Month.
Thank you, Mindy. All right, everyone. So good afternoon. My name is Annie Marie Morales, and I work with PEI, and I support all things Riverside County Suicide Prevention Coalition. So today I'm briefly going to share about some of the activities the Suicide Prevention Coalition has sponsored, organized, or developed over the past few months. As you all know, every September we do recognize Suicide Prevention Month here in Riverside County, in an effort to decrease stigma and increase awareness around suicide prevention. So each year, Take Action for Mental Health, also formerly known as Each Mind Matters, releases toolkits to coincide with Suicide Prevention Week. This year, Suicide Prevention Week was from Sunday, September 7th, to Saturday, September 13th, and World Suicide Prevention Day was on September 10th. So this year's theme was Reach Out. This theme acknowledged that we need to find what is our best way to help others, but no matter what, to reach out. Even people who have not had mental health issues may experience suicidal thoughts and may need someone to reach out to when in need. During the month of September, we shared practical activities and events to foster social connections that may best fit you or someone you love. Through the power of love and connection, we can support and help connect individuals to resources, allowing us to take action for suicide prevention together. So we're going to start off by sharing the Suicide Prevention Toolkit that was released. Take Action for Mental Health provided downloadable suicide prevention toolkits. Please note that PEI did not receive any physical toolkits this year. However, there are many downloadable resources and activities provided in the online toolkit, and all toolkit items are available in both English and Spanish. So one of the things that they provided this year was a palm card when you need to talk, and it just comes with helpful resources to have on hand if you're going to talk about someone who might be having thoughts of suicide. They have a scenario booklet, Support Your Way, that gives you real life scenarios that have happened and how they were tackled on. Support guide, finding help for you. One must take care of themselves first before they can help others. So making sure that you are supported and finding what's best for you to help others as well. And if you scan the QR code, you can access the toolkit, which is there year round. So next, the downloadable toolkit also has a variety of social media graphics. Sorry. I don't know why my thing froze. And captions for weekly posts. They have Zoom backgrounds, website banners to use during the Suicide Prevention Month, which we hope that some of our people that were able to access them were able to use throughout September. And so another thing that we did in addition to participating in the Suicide Prevention Week activities, Riverside County released a full calendar of local events and activity guides to recognize these important events. You can also download the link and scan the QR code. You don't have to only use it in September. You're more than welcome to use those other activities that throughout the year. They all encourage wellness and suicide prevention. And some of the trainings we have are still year round, so you can still scan and register for one of those trainings. So next, one of the things that RUHS Behavioral Health used their social media platform on Facebook and Instagram to bring awareness to Suicide Prevention Month. And there you can see we shared a lot of different things on social media to hopefully get people to know the resources and just overall awareness and stigma reduction. And so next, one of the things in September, we always hold trainings, and we try to highlight them more and get people trained in suicide prevention and mental health. So all in total, we trained 263 participants in the month of September in all the trainings there that we have listed available. And then October 4th, we held our Riverside County Out of Darkness Walk. So this is the third year the Suicide Prevention Coalition partnered with the American Foundation for Suicide Prevention to support our local Out of Darkness community walks. So the next one was our Coachella Out of Darkness Walk, which was held October 25th. And I put the link there if you want to see the news coverage over for that walk there. And then on October 2nd, the Riverside County Suicide Prevention Coalition hosted its fourth annual Suicide Prevention Coalition Conference. The conference was a full-day event centered around learning, collaboration, and development. Hopefully some of you were able to attend. And so just to highlight the conference at a glance, the theme surrounded the conference was Postvention as Prevention, Supporting Suicide Loss Saves Lives. Approximately 400 participants attended. We had one keynote, 3 breakout rooms, vendor and subcommittee outreach tables, and 2 suicide loss survival panelists with Q&A. And so with our conference presenters, we had David Schoenfield as a keynote. His topic was supporting children, families, and communities after a death by suicide, promote appreciation of role schools can serve to support students, staff, and families at times of crisis and loss. And one of the next one is our breakout room presenters. We had 3 different breakout rooms that focused on different topics. The first one is postvention and culture, at the intersection of suicide loss and culture. We had postvention in the workplace, when the incident breaks all the rules, critical incident response following workplace suicides. Prevention in schools, district collaborating for hope, district and county partnership in suicide prevention and postvention. And we had many different attending agencies and affiliations. So as you can see, we have a list of different all walks of life there attended the conference. And so the evaluation highlights, we had a total of 101 surveys collected, and overall 73% of the attendees were very satisfied with the attendance and 20% were satisfied. So just some survey comments and feedbacks. We had a lot of wonderful comments that were left back on the surveys, such as all keynote topics and speakers were very knowledgeable of their topics. Presentation was very informative, learned a lot. Great event. I would love being able to see this online, which if you are interested in seeing the conference, everything but the breakout rooms is available online at rivcospc.org. And you can see it off of our YouTube link there. So next, we wanted to highlight our suicide bereavement counseling. There are 17 therapists available virtually or in person. So after a loss has occurred, there's free therapy sessions for suicide loss survivors. And that's something that the coalition just recently started. So we wanted to highlight and share that. And then we also want to share the International Survivors of Suicide Loss Day. It's coming on Saturday, November 22nd, 2025. We have more information coming with the registration and where the event will be held. So be on the lookout there for an email coming soon. And thank you. Thank you all of you for your time and attention. If you have any questions, feel free to email us at pei@ruhealth.org. And remember, together we can help prevent suicide in Riverside County. So thank you. And if you have any questions, please let me know.
Okay, thank you, Annie. Were there any questions? Comments? Okay. Well, if there were none, then we'll go ahead and move into any announcements from our PEI providers. Any provider announcements? Not all at once, but okay. Well, if there's no provider announcements, we'll open it then for community announcements and just roundtable. Any announcements anywhere? Yes, Claudia.
Just an announcement that our Mamas y Bebés classes are available. We have some English virtual and Spanish virtual classes in the morning. We also have an evening one Wednesdays at 5:30 to 7:30 p.m. And we started an in-person class in the IHP Resource Center there in Tyler and Riverside that started today. So if you have any moms that live in Riverside or have any services in Riverside, please let us know. And yes, that's my announcement. Thank you.
Thank you, Claudia.
Hi, this is Glenda. I do have an announcement to share
Mm-hmm.
to my calendar. So, I'm from Asian Pacific Counseling and Treatment Centers. I'm with the KITE program, the parenting class, and I just want to share that we have some workshop. It's a combo workshop. I'm going to be giving a parenting workshop, and my colleague in the mental health department is also giving a mental health workshop, and we have two. One is on the 9th of November, and it's going to be hold on one second. It's at 11. This is tentative. We're waiting for the priest to give us a time, but I believe this is now going to happen at 12 p.m. On November 9th, after their second mass, November 9th at 12 p.m. And that's a combo workshop with me and Nicole from mental health. And then on the 23rd of November, we are having the same combo workshop at the Shrine of Presentation on South Main Street, and that will be um, at at 12 noon. At 12 noon. And I can put on the chat, I'll put my email because I'm obviously given you a tentative time for the church at St. Mary Magdalene in Corona off of it's not far from the shopping center, Del Lago, but I'm going to give you my email here. Please feel free to email me if you're interested, and I can give you the more finalized time for that. So let me share that. And I think that's all I have. Thank
That's
you.
great. Thank you, Glenda. And I was also going to ask if Claudia, if you can put your contact in the chat. So if there's folks that are interested and or know mothers that would benefit from that they can contact you to get involved with those classes. And I see Safe House is having a 35th anniversary gala on November 8th featuring Andrea McArdle. You can purchase tickets online. Thank you, Norma. Thank you for sharing that, Glenda. And I see Hazel, you have your hand up.
Good afternoon, everyone. I'm Hazel Lambert. I am one of the cultural community liaison representing the African American community. I chaired the AFWAG committee, which is, again, African American Family Wellness Advisory Group. We're meeting the third Wednesday of the month via Zoom. In November, we're going to be hosting a Black men's panel to discuss health and wellness. I think this is something that's very important because, as we know, oftentimes Black men don't speak about those things. So it's an opportunity to hear them out and get an idea of what's going on with them. So that's going to be the third Wednesday, November 19th. And also, as the liaison, I'm available to come out and do presentations. One of the biggest ones that we're focusing on now is the evolution of beauty standards, the psychological impact that talks about mental health. It talks about eating disorder and all those things that affect individuals trying to live up to these various beauty standards. So thank you.
Thank you, Hazel. Is there a flyer that has the link for folks to get onto that meeting?
I will send that out. I'm not sure how to attach it here, but
If you
who,
email
who
it
can I
to
send it? Can I send it to who can I send
email
it to
to our
this?
PEI contact, the PEI at RU Health, and then we can send that out with our meeting.
Thank you so much.
Mhm. Thanks, Andrea. Awesome. Oh, and I see Dakota has the Wellness and Disability Equity, our WADE Alliance, meets on Zoom a week from Friday on November 7th. We got the Zoom link there as well. And perfect, thank you. And the October meeting posted on YouTube. Great. Awesome information. Other announcements? Yes, Shirley.
Hi. So actually, Glenda reminded me that we're gonna have a Tai Chi self-care outreach at Corona New Start CBAS. I'm gonna send you the information, and also on November 15, that was the tentative date, we're gonna have a You Hike and Talk. That is a workshop in Temecula, Mid-County. So I'm going to send that information to you too. Thank you, Mindy.
That's great. Thank you for sharing, Shirley. We'll be sure to get that out to everybody from that attended today. Other announcements?
Can I, sorry, so I work with Sister Hannah, with trying to outreach to these, Catholic churches. And I did see a confirmation that for both churches on November 9th and the one on November 23rd, the combo workshop from us at APCTC will be at 12 noon.
Okay, perfect.
Thank you.
Great. Anyone else? Okay. Well, I want to thank everybody for attending today's quarterly meeting. And if there's flyers that you have that you'd like us to share out, I see the wonderful information that is put in the chat about upcoming events and links and details. But if there's a flyer that you have for those, also send it to the PEI at ruhealth.org inbox, and we can let them know that we'd like this sent out for the collaborative notes, and we can send that out to everyone. And in that case, I guess we're going to be gifting some time back to everybody today. So thank you all for attending. We'll see you at the next one, and have a great rest of your day.
Thank you.